And as mentioned, Dr. Tim McKnight joining us, usually in person, but via phone today. So thanks for coming in, Dr. McKnight. How are you?
I'm doing pretty well, I think.
Good. That is good to hear. And we did want to talk about high blood pressure, hypertension today, and who knows who has it? I guess if you don't check, you don't know, and that could be dangerous, right?
Yeah, that's exactly it. I know we've talked about it before, but we can talk about it a little bit differently today. I think the problem that I see with a lot of people is their blood pressure is elevated and they don't know it. Or they'll come in the office and we'll have a high reading in the office and we'll think, well, we need to put you on a blood pressure medicine. And sometimes we do that, and then their blood pressures are too low because the office blood pressure reading doesn't represent their normal blood pressures.
And
So we have to be careful.
that's fairly common, isn't it?
It really is common. The white coat syndrome, where people just feel a little bit anxious and worried that maybe, if this is not right, I'm going to have to take another pill.
Mm-hmm.
And some people aren't anxious, but just the idea of being in a hospital or a doctor's office feeling vulnerable is enough anxiety to sort of get the adrenaline response up, the fight or flight syndrome going, and the blood pressure goes up as a normal reaction for that fight or flight condition.
Yeah.
So we have to be careful. And what I tell patients to do is get a blood pressure cuff and check it at home. Check it different times of the day and in different circumstances throughout the day. And then show me those numbers, and then together we'll decide if this is something that should be treated.
Yeah, that's as if you have 10 readings to look at rather than one or two. I mean, you can make a much better educated diagnosis, I'm sure.
Yes, absolutely. And that's what we're trying to do is we want to treat a problem when it's a problem. But a lot of people don't realize they have an issue because they don't check it, and they don't. Sometimes you don't feel that the blood pressure is elevated, and then what happens is high blood pressure over many years can put you at risk for heart attack, stroke, and kidney disease or kidney failure. So we never want to be caught off guard. That's why we like to see even healthy people. We like to see them once a year to check those kind of things, to look at their kidney function and to check their blood pressure, make sure they're not having any symptoms, because it is the silent disease for most people. And it's something that if we detect early, it doesn't mean that we have to manage it with medication, but we need to be aware of what's happening, and there's other interventions besides medication. So I think that's what people need to be aware of.
When you're checking your own blood pressure, are there numbers that you need to be aware of as being too high or too low? Because there are two different indicators, the top number and the bottom number. So,
yes, and we've talked before about the top number is the systolic number, and that is the pressure that is required to open up an artery that's being occluded by that cuff as it squeezes. So it's a high pressure that kind of pushes the artery open.
mm-hmm.
And that is the number that we tend to get the most concerned about in terms of treating blood pressure. We have kind of flip-flopped on this over the years between the top number and the bottom number, which is the diastolic blood pressure. But it seems to be that the systolic blood pressure is the one that's probably a little bit more critical. So that's the one we look at.
What are
and they have different?
Oh, go ahead.
Go ahead. I was going to say they have different ranges. The American Heart Association has lowered the threshold. So we used to say 120 over 80 was the ideal blood pressure, and now we're saying we want it below 120 over 80. And if it's, say, 125 over 82, that's considered pre-hypertension. That's considered a little bit too high. So that range of pre-hypertension goes from 120 on the top up to 140, and then the bottom number goes from 80 to 89 or 90. And that is a range where we're supposed to start talking to you about, okay, how do we get this down? Do we need medication? And then clearly, if it's above 140 over 90 most of the time, that is too high, and that is causing damage to your kidneys, your arterial lining, putting you at risk for heart attack and stroke down the road. So those definitely need to be treated. And the mortality curve goes way up once your blood pressure is consistently above 140/90. We know that's dangerous. And the higher that number goes, those numbers go, the more dangerous it is.
So, I mean, obviously there are treatments that you can administer, but are there other ways to lower your blood pressure more naturally through diet and exercise and that sort of thing?
Oh, absolutely. Yes, that's the key, I think, is lifestyle changes. Now, there's some people that are not going to be able to exercise or diet their way up high blood pressure, but I think that's the exception. Most of us, if we would lower the body fat, especially that fat on our belly, if we would get rid of the belly, we know that that visceral fat is very inflammatory and it causes the blood pressure to elevate. So we want to lose that weight. We know that exercise forces the blood pressure to initially go up when you're exercising, but then once you're done exercising, the pressures come down. And what we're doing with exercise is we're telling the artery, you need to make more nitric oxide because you need to dilate the blood vessel. And nitric oxide is the key way, is the key mechanism that keeps the blood pressure down. Unfortunately, many of us lose nitric oxide with age.
Mm-hmm.
So we need to be eating green leafy vegetables, and we need to avoid those things that block natural nitric oxide production, like mouthwash and scrubbing the back of our tongue when we brush our teeth, and using the acid blockers that turn an acidic stomach into a neutral stomach because we're taking Maalox or Tums or Pepcid or Protonix or omeprazole. All of those things can impact nitric oxide production.
Probably a good message right after Thanksgiving, right?
Oh, yeah. And we also know that a high sugar diet seems to increase blood pressure. So there's another one. I mean, if we could all check our blood pressure on Black Friday, I think many of us would be shocked at how high the blood pressure is just from what we ate the day before.
Mm-hmm.
But that doesn't mean it's always going to be that high. It may come down over a couple of days as we get back to our normal routine and our a more normal diet. But there are times that the kidneys sometimes can not be operating properly, and that can lead to high blood pressure. So that's one of the reasons we want to check your kidney function once a year. We like those annual health screens that you bring in, and we go over and we look at those things closely. So there are a number of things that we can do before we say you're going to be stuck on blood pressure medicine the rest of your life. And I've seen in my practice and with participants in Fit for Life, when they make these changes, most of the time they're able to have a significant reduction in their blood pressure and either get off of their medications or lower the number of medications they take. And that's always the message about lifestyle, is we're trying to restore the body back to its usual state of trying to keep us healthy.
Right. Yeah. The less medications, the better, for sure. Right.
Oh, yeah, I think so.
All right. So on a day-to-day basis, exercise, diet, and maybe checking that, I mean, if not daily, weekly, to see what your blood pressure is?
Yeah, and when you go into your doctor's office and you've been told that your blood pressure is borderline or it may be high, check your blood pressures at home. Get a good blood pressure monitor. Get one that goes over your arm, not your wrist, and check it and write those numbers down and come in with 20 different blood pressure readings and the date and the time that you checked them and show that to your provider. I think that's a pretty persuasive argument, because what we'll see is a range, and then we have to decide if that range is acceptable, because we're not a machine. We're going to have days or times when the blood pressure is up a little bit, and then other times when it's going to be down. And we want to see where that range is, and that helps us make a decision as to how much we need to intervene and what we need to do to make sure that those levels are safe.
Right. All right. So get an appointment too.
Yes, I think that's critical. I think some people are afraid to go to the doctor because they're afraid they're going to be put on medication, or we're going to order tests, or sometimes they're just afraid we're going to find something really bad, and they prefer not to know.
Yeah.
But in my practice, and I think many providers, we're trying to keep you healthy. We're trying to avoid these problems so you're not on medications and we're not finding problems. It's just like a car. You've got to take your car in for a maintenance check every 10,000 miles to make sure everything is operating as it should be, and that's kind of what we're trying to do with these annual exams.
All right. Well, Dr. McKnight, thank you for that, and we'll keep on the lookout and have you come in and join us again next week.
Okay, I look forward to it. Thank
All right,
you, Brett.
thanks a
Have
lot.
a great day.
As always, we talk with the doc, Dr. Tim McKnight here